Take you live now to Canberra. The Deputy Chief Medical Officer, Nick Coatsworth, with a COVID update.
3 of those cases were diagnosed in New South Wales, 2 of whom were returned travellers, and 1 case is currently under investigation. There have been 2 new cases diagnosed in Victoria. 1 is a returned traveller in hotel quarantine, and the other was actually a resident of an aged care facility in northeastern Victoria. That person is currently being isolated in hospital where they were transferred for an unrelated condition. The remaining residents of that particular facility have been placed in quarantine and contact tracing has begun. There have been no new deaths from COVID-19 overnight. Regrettably, 102 Australians have lost their lives to COVID-19. There are currently fewer than 460 active cases of COVID-19 in Australia. 19 individuals are hospitalised, 3 patients are in ICU, and 2 of those are on ventilators, assisting them breathe with severe coronavirus disease. I did want to highlight that the total number of confirmed COVID-19 cases over the past week has been 61, which is down from 91 the week prior, and nearly 7 out of 10 of those cases have been overseas acquired. So low numbers of cases over the past week, sometimes in the single digits, as in today with 5 new cases overnight, and a large majority of those remain overseas acquired rather than community acquired in Australia. After our peak of cases in March, we continue to see a sustained low number of cases on a daily basis in Australia. I did want to mention today the funding announcement from the Minister of Health, Minister Hunt, of $2 million to help find a cure for motor neurone disease. I was a junior doctor at Royal North Shore Hospital when I was taught in a neurology term by Professor Dominic Rowe, who is one of Australia's leading researchers and clinicians treating motor neurone disease. Dominic impressed upon me how severe, how unrelenting the condition of motor neurone disease is, how it takes the lives of those who are affected by it far too early, takes them away from their friends and family prematurely. It highlights to me the importance of ongoing funding for research for conditions other than COVID-19, conditions that are very severe and severely affect those who suffer from them. It also makes me reflect really on the reason why we had to have the restrictions for COVID-19, why society had to undergo such a profound restriction on what we're used to, but more importantly, why we need to continue those behaviours that have put us in such an important condition, led us to such an important position. And that is because COVID-19 would severely affect someone with motor neurone disease or many chronic conditions. For motor neurone disease in particular, a condition that will take someone's life far too early, getting infected with COVID-19 would take them away from their friends and family even sooner. It reminds me that COVID-19, we are still in the pandemic. It is still a danger to us, and it is still a danger to our most vulnerable people. And the important measures of keeping our distance where we can, of washing our hands, of excellent cough etiquette, and all those great behaviours that we've learnt, they must continue. COVID-19, as we lift the restrictions, must stay in the forefront of our minds so we can protect the most vulnerable members of the community.